Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
Not every cough and sniffle, cut and scratch, or bruise and bee sting necessitate a trip to the doctor's office or even the hospital. Most parents can handle these everyday mishaps with a little bit of instruction and the right supplies. That's where we come in. Today, we're going to equip you with enough practical first aid tips and tricks to help any parent become a well-trained Dr. Mom or Dr. Dad. So send your questions to us because I'm ready to get my answer on for this episode of Ask the Doc. Welcome, everyone, to Ask the Doc, the show where we encourage our viewers to send in their health questions. I'm Nurse Katie, and today we're going to empower you to take care of some of those minor medical situations at home. First aid and basic life support are crucial forms of assistance offered to somebody in need, ensuring they receive immediate care and support. A first aider plays a vital role in safeguarding the well-being of others and preventing any further harm. The aim of first aid is to preserve life, prevent further injury and deterioration of the condition, to make the victim as comfortable as possible to conserve strength and promote recovery, and put the injured person under professional medical care as soon as possible. While providing first aid, it is important to observe, act quickly, and try to remain calm. It's also important to provide reassurance to the victim who may be apprehensive or anxious. Some of the golden rules of first aid is to your personal safety comes first. Assess the situation and the victim. Call for help. Control any kind of bleeding. Treat for shock. Be mindful of head and spinal injuries and attend to burns. The main goals of first aid include the 3 Ps: preserving life, preventing deterioration, and promoting recovery. Let's kick things off with a YouTube question from Ellie. Hi, Nurse Katie. I recently found out that my first cousin, Sarah, is allergic to bee stings. I can't believe I never knew this. Anyways, now I'm concerned that one of my 2 children might also be allergic. What should I do if one of them has an adverse reaction to a sting? And what should I do, even if they don't have an adverse reaction? Ellie, I'm so glad you asked me these questions. Thanks for reaching out. It is now summertime, and many people are enjoying the fresh air. However, with fresh air comes bugs and bees. Let's discuss what to do if you get stung by a bee. First off, if the stinger is present and you are able, you can remove the stinger as soon as possible, such as by scraping it off with a fingernail or a credit card. If you do not remove the stinger, it will release venom into your bloodstream and can cause further symptoms, such as increased swelling, dizziness, difficulty breathing, and sometimes nausea. It also increases your risk of developing an infection at the sting site. The stinger looks like a tiny black dot in the sting. Use a fingernail to remove it. Wash the affected area with soap and water. You can apply a cold compress. You can wrap an ice pack in a towel and place it on your skin to reduce the swelling. Elevate the affected area of your body to lessen the swelling. You can also take an over-the-counter pain reliever as needed. Bee stings are painful and can cause itchiness. So antihistamines can also reduce skin symptoms, and over-the-counter pain medications like acetaminophen or ibuprofen can relieve your pain. Use these medications as directed on the label. You can also use calamine lotion or hydrocortisone cream to ease the itching. If the sting is on the arm or the leg, elevate it above the level of your heart if you can. You can usually put a couple pillows underneath it, and that will help. If you ever encounter a bee sting, some people find relief by using baking soda to neutralize the venom. To try this remedy, mix baking soda with water to create kind of a paste, and then generously apply it to the affected area. Cover it with a bandage and leave it on for at least 15 minutes, reapplying as needed. This method has been used by many, including my Nana actually, who always used to do this for us, and I remember feeling instant relief. Bee stings can be quite painful and may cause discomfort for a few hours. Some reactions such as swelling, skin discomfort, discoloration, and itching can last for a few days. Although severe allergic reactions are rare, they can be life-threatening, requiring immediate medical attention. Swift treatments with epinephrine can lead to a positive outcome. If you have a bee sting allergy, it's important to always carry an emergency epinephrine auto-injector and inform your loved ones about what to do in case of an emergency. Now, you might think you cannot avoid bee stings, but you can. Here are some tips. Be aware of your surroundings. If you're outdoors and near flowers or areas where bees are active, be careful not to disturb them. Remove food. Bees are attracted to foods that you might have at a picnic or outdoor event. Try to cover foods and clean up any dirty dishes to keep the bees away. Try not to use any floral scented products. Bees like flowers or fruity scents. If you use hair or skincare products that smell like fresh flowers, bees may mistake you for one. You can also wear protective clothing. Choose clothing items that cover your skin, like long sleeves and pants, especially if you're working out or playing outdoors. It's very easy to step on a bee, so wear closed-toed shoes instead of bare feet when walking in the grass. And always remember to stay calm. Bees aren't aggressive insects and only use a stinger to protect themselves. If you swat at bees or try to shoo them away, you put yourself more at risk of getting stung. If you stay calm and let the bee pass by, it will go away without harming you. Now, if you do get stung by a bee, how do you know if you should go to the ER or not? Here are some symptoms that might require some immediate attention, like difficulty breathing, a tight feeling in your chest, difficulty swallowing. You might develop hives or a skin rash, swelling all over your body. You might feel dizzy or lightheaded and have stomach cramps, vomiting, or even diarrhea. All right, looks like our next question is very important and comes to us from Clint, who reached out via our very own website, allhealthtv.com. Clint asks, "Hi, Nurse Katie. I had a couple of concussions when I was growing up. I now have 2 boys of my own who always roughhouse with each other. So it's just a matter of time until one of them hits his head on something. I guess my question is this: how can I tell if someone has a concussion? And if they do, what should I do?" Clint, I said this before, this is a very important question. Anytime you hit your head, it's crucial to monitor for those signs of concussion or a serious injury. So first of all, number 1, severe head or facial bleeding might be a sign of a concussion. Number 2, bleeding or fluid leaking from the nose or the ears. Number 3, vomiting. Number 4, a severe headache. Number 5, change in your consciousness for more than a few seconds. Number 6, black and blue discoloration below the eyes or even behind the ears. Number 7, not breathing. Number 8, if you have any confusion. Number 9, you might be agitated. Number 10, you might have a loss of balance or feel kind of dizzy. Number 11, weakness or an inability to use your arm or your leg. Number 12, your pupils might be unequal in size. Number 13, you might have slurred speech. And number 14, you may develop seizures. Now, children have very similar symptoms of adults, but can also have persistent crying. They may refuse to eat. Infants may have a bulging soft spot on the front of their head, and they might be continuously vomiting. Administer the following first aid steps while waiting for an emergency medical to help arrive. Keep the person still. The injured person should lie down with the head and shoulders slightly elevated. Don't move the person unless it is very necessary. Avoid moving the person's neck. If the person is wearing a helmet, do not remove it. Stop any bleeding. Apply firm pressure to the wound with sterile gauze or a clean cloth. But don't apply direct pressure to the wound if you suspect anything is wrong with their skull. Watch for changes in breathing and alertness. If the person shows no signs of circulation, no breathing, coughing, or movement, begin CPR. There are some quick concussion tests you can administer at home. Concussion tests assess your brain function after a head injury. Most concussion tests consist of questionnaires or symptom checklists. Concussion tests check for alertness, memory, focus, how fast you can think, and your ability to solve problems. They also check your balance and coordination. Concussion tests are one of the tools used to diagnose a concussion. It is important to know that only medical professionals can examine you or a loved one in order to need a test to diagnose a concussion. However, in some instances, you can ask a few questions and gather some information to share with the doctor. Some questions you can ask may include having the person state their name, where they are, the time and date, and what just happened. You can have them spell words or have them spell words backwards. Sometimes that would help kind of indicate if they have a concussion or not. You can ask them, do you have a headache? Do you feel dizzy or nauseous? You can also have them follow your finger to see if their movement with their eyes follows the finger or not. You can ask them if their speech is normal and have them talk to you and see if it's slurred or not. See if they're sensitive to light or sound. And also see if there's any changes in their behavior. Do they seem restless, agitated, or confused? It is very important to never diagnose a concussion on your own. No matter how minor a head injury may seem, it's crucial to have it evaluated by a medical professional. Head trauma resulting in concussion symptoms should be evaluated right away. All right, our next question comes from an unusual source, me. This is probably one of the most terrifying situations any parent will experience, your child choking. Now, this issue hits close to home for me because my husband almost choked to death a few weeks ago. Thankfully, his friend knew exactly what to do when someone is choking. It's important to remember that it is scary and it is a life-threatening situation. When an object becomes stuck in the throat or windpipe, it can prevent air from reaching the lungs, causing serious distress. It's especially common for adults to choke on food, while young children may swallow small objects. If you or someone else is choking, it's crucial to act quickly and administer first aid. Consider taking a certified first aid training course to learn the Heimlich maneuver and even CPR, so you can be prepared to help in these emergencies. If you're the only rescuer, you can give back blows and abdominal thrusts. Then call 911 or your local emergency number for help. If another person is there, have that person call for help while you give first aid. If you're alone and choking, call 911 or your local emergency number right away. Then give yourself abdominal thrusts, also called the Heimlich maneuver, to remove the stuck object. With other people, you need to watch for these signs of choking. One or both hands clutched around the throat. A look of panic, shock, or confusion. The inability to talk. They might have strained or noisy breathing. They might have squeaky sounds when they are trying to breathe. They might be coughing, which may be either weak or forceful. Their skin, lips, and nails may change color, turning blue or gray. And they might even lose consciousness. So to clear the airway of a choking infant that's younger than 1 year old, you want to sit and hold the infant face down on your forearm. Rest your forearm on your thigh and hold the infant's chin and jaw to support the head. Place the head lower than their trunk. And then you want to thump the infant gently but firmly 5 times on the middle of the back. Use the heel of your hand. Point your fingers up so that you don't hit the back of the infant's head. And the gravity will help with the back thumps and should release the blockage. If a choking person can cough forcefully, let that person keep coughing. Coughing might naturally remove the stuck object. If a person can't talk, cry, or laugh forcefully, then it's time to give first aid. So for a child above 1 to an adult, you want to give 5 back blows. Stand to the side and just behind a choking adult. For a child, you want to kneel behind them. Place your arms across the person's chest to support the person's body. Bend the person over at the waist to face the ground. Strike 5 separate times between the person's shoulder blades with the heel of your hand. If this doesn't work, then you want to give 5 abdominal thrusts. If the back blows don't remove the stuck object, give 5 abdominal thrusts, also known as the Heimlich maneuver. Then alternate between 5 blows and 5 thrusts until the blockage is dislodged. Some sources only teach the abdominal thrust, which is okay. And to give abdominal thrust to somebody, you want to stand behind the person. For a child, kneel down. Make a fist with one hand and put it just above the person's belly button. Grab the fist with the other hand. Press it into the stomach, also called the abdomen, with a quick upward thrust, as if trying to lift the person up. For a child, use gentle yet firm pressure to avoid any damaging the internal organs. If the person becomes unconscious, start CPR with chest compressions and rescue breaths. Now, if the person does go unconscious, sometimes you need to clear the airway because the blockage might be right there in the throat. So if the person is unconscious, Lower the person to the ground with the back on the floor and arms to their sides. If you can see the object, reach a finger into the mouth to sweep out the object. Never finger sweep if you cannot see it, as you risk pushing the blockage deeper into the airway. This is very risky with young children. And if the person remains unconscious and not breathing, begin CPR. If the person is pregnant or you can't get your arms around the stomach, you want to give chest thrusts. Put your hands at the base of the breastbone, just above joining of the lowest ribs. Press hard into the chest with a quick thrust. This is the same action as the Heimlich maneuver. And continue to repeat until the blockage is removed from the airway. All right, this next question comes to us from our Instagram page. Bella's question is, Nurse Katie, my daughter Holly is your stereotypical tomboy. She likes playing soccer, skateboarding, and catching frogs with the boys. And just like the boys, she comes home with assorted cuts and abrasions. What's the best way to treat them at home? And when should I take her to the doctor? Hi, Bella. Great question, and thanks for reaching out. Minor cuts and scrapes can often be treated at home. You may need to seek medical care if you notice the injury becomes infected. The following guidelines can help you for minor cuts and scrapes at home. So number one, you want to wash your hands. This help avoids any kind of infection. Number two, you want to stop the bleeding if there is any. Minor cuts and scrapes usually stop bleeding on their own. If needed, gently press the wound with a clean bandage or cloth. Elevate the area until the bleeding stops. Number three, you want to clean the wound. Rinse the wound with water. Keeping the wound under running water will lower the risk of infection. Wash around the wound with soap, but don't get soap in the wound. And don't use hydrogen peroxide or iodine. Both can irritate the wound even further. Remove any dirt or debris with tweezers cleaned with alcohol. See a healthcare professional if you can't remove any debris. Number four, you want to put on an antibiotic or petroleum jelly. You want to put on a thin layer of an antibiotic ointment or petroleum jelly like Vaseline or Aquaphor to keep the surface moist and help prevent the scarring. Number five, cover the wound. You can put a bandage, rolled gauze, or even a Band-Aid and help it hold in place with paper tape. Cover the wound keeps it clean. If you just have a minor scrape or scratch, you don't need to cover it. And number six, you want to change the covering. Do this at least once a day or whenever the covering becomes wet or dirty. You might also ask, when are stitches needed? There are other guidelines to follow. Stitches might be needed for any cut that is split open or gaping. Cuts that are longer than a ½ inch usually need sutures. If you have any cut on the face, longer than about 1/4 of an inch, you need to be seen by a medical professional because they may need to close it with sutures or even glue. And any open wound that needs sutures should be seen as soon as possible. Ideally, they should be checked and closed within 6 hours to prevent wound infections. Now, we discussed when you might need stitches and how to treat the injury, but when is it essential to seek immediate medical intervention? Some things might be if your skin is split open or gaping, if you have severe pain and it doesn't improve after 2 hours of taking a pain medication. If you have a child that is less than 1 year old, you need to be seen immediately. If there's any dirt in the wound that isn't gone after 15 minutes of scrubbing or irrigating. If there's any skin loss from the bad scrape or if it goes very deep. If there's a cut or scrape that looks infected, or if you have not had a past tetanus shot. All right, what do we have here? This question is from Isaiah, who reached out to us on allhealthtv.com. You should really go check it out when you get a chance. It's chock full of great information. All right, Isaiah asks, hi, Nurse Katie. My daughter Kimmy is susceptible to nosebleeds, just like her old man. She lives with her mother in Los Angeles, where the air is much drier than it is in Florida. This, combined with allergies, causes my baby's nose to bleed. What can we do next time to stop the bleeding quicker? Isaiah, I'm really sorry to hear about Kimmy's nose. LA, you say. I might suggest getting a humidifier as well as some nasal saline to help keep her nose from getting too dry. Now let's talk about stopping the bleed. I understand that dealing with nosebleeds can be very concerning. Nosebleeds, also known as epistaxis, happen when a blood vessel in the lining of the nose bursts. They can be caused by various factors, such as an infection, injury, any allergic reaction, nose picking, or the insertion of an object into the nostril. It's important to remember that while nosebleeds are a common occurrence in children, they're typically not considered serious. So how do you stop a nosebleed fast? First, you want to pinch the nose. You want to sit down at a table, lean forward, and firmly pinch the soft part of your nose, just above your nostrils, like right about here. And you want to hold for 10 to 15 minutes. Do not remove, do not look and see if it stopped. Just do it continuously for at least 10 to 15 minutes. Lean forward and try to breathe through your mouth. If there's any blood that collects in your throat, spit it out into a bowl. If you're actively bleeding after 30 minutes, you should probably head to the ER, particularly if you're experiencing any other symptoms such as lightheadedness or dizziness. Now, after a nosebleed stops, here's what you should not do for the next 24 hours. Number 1, do not blow your nose. Number 2, do not pick your nose. Number 3, refrain from drinking hot drinks or alcohol. And number 4, do not do any heavy lifting or strenuous exercise. So what should you do after a nosebleed? Try to lay flat as much as possible. Raise your head on a pillow while you sleep. And number 3, put a thin layer of a saline or water-based nasal gel inside your nose. All right, we got one more question here from Sadie. Sadie asks, "Hi, Katie. I just saw a story on the news about a child who suffered third-degree burns because of an accident in the kitchen. With 3 young kids, we've been very lucky with no burns, but our luck is going to run out. So we want to make sure we know more about types of burns and how to treat them." Hi, Sadie. I love the fact that you are being so proactive. I also have 3 kids, so I understand the chaos that comes with them. Burns commonly occur by direct or indirect contact with heat, electric current, radiation, or chemical agents. Burns can lead to cell death, which can require hospitalization and can be fatal. There are 3 levels of burns. First-degree burns, which affect only the outer layer of skin. They cause pain, redness, and swelling. Second-degree burns affect both the outer and underlying layer of skin. They cause pain, redness, swelling, and blistering. They are also called partial thickness burns. Third-degree burns affect the deep layers of skin. They are also called full thickness burns. They cause white or blackened burned skin. The skin may be numb, and you may experience no pain with these burns. Now, it's important to remember that burns can be a very serious and painful injury. Having more than one type of burn at the same time can be particularly difficult to deal with. Major burns require immediate medical attention to prevent scarring, disability, and deformity. Burns can be the result of the following: a house fire, a car accident, playing with matches, and even some kitchen accidents. All right, now let's talk about some kind of first aids we can do with just some minor burns. If someone is on fire, well, that's a major burn. If someone's on fire, tell the person to stop, drop, and roll. Then follow these steps. You want to wrap the person, pour water on the person, and call 911. You want to make sure that the person is no longer touching or burning on any of the smoking materials. Do not remove burned clothing that's stuck on the patient's skin. And ultimately, you want to get them to the ER as quick as possible. And remember, it's crucial to do the following to burn victims. Don't apply anything to the burn. Don't breathe, blow, or cough on the burn to try to cool them off. Do not disturb the blistered or the dead skin. Do not remove clothing that is stuck to the skin. And do not give the person anything by mouth if there is a severe burn. All right, well, thank you for watching. This is it on Ask the Doc.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.